Nipah virus. 2026. What, why, how, what next? Headlines about a deadly Nipah virus in India are circulating widely. What is Nipah virus? Nipah virus is a zoonotic virus. It circulates in animals and can infect humans. Fruit bats, particularly flying foxes, are the main known reservoir. The virus was first identified in 1998 to 1999 in Malaysia and Singapore during an outbreak linked to pigs and pig farmers. Since then, smaller outbreaks and clusters have been reported in Bangladesh and India. In humans, Nipah infection typically begins with fever, headache, and general malaise. In a proportion of cases, it progresses to severe respiratory disease and encephalitis, an inflammation of the brain, which can lead to confusion, coma, and death. Reported case fatality rates in past outbreaks have generally ranged between roughly 40 and 75%. There is currently no licensed vaccine and no specific approved antiviral treatment. Management is based on supportive and intensive care. What is happening in 2026? In January 2026, India reported a small Nipah virus event in West Bengal, near the Bangladesh border. 2 confirmed cases occurred in nurses working at the same private hospital in the district of North 24 Parganas. After confirmation, health authorities isolated the patients and initiated contact tracing. Close contacts included family members, colleagues, and others with potential exposure. Approximately 200 contacts were identified and placed under active follow-up. They were monitored for symptoms and tested as indicated. At this point, no additional confirmed cases have been reported among those contacts, and there is no indication of broader community transmission from this cluster. Current formal risk assessments describe the risk as moderate in the directly affected area and low at national, regional, and global levels. There are no confirmed cases linked to international travel in this event. However, several countries have implemented precautionary screening measures at airports and other points of entry. Why does Nipah matter? The scale of the current event is small, but Nipah remains a high-consequence pathogen for several reasons. First, clinical severity and mortality are high compared with many other viral infections. Even limited transmission can result in substantial impact at individual and local health system levels. Second, the virus is maintained in fruit bat populations that are widely distributed across parts of South and Southeast Asia. Changes in land use, agriculture, and urbanization can increase contact between bats, humans, and domestic animals, raising spillover risk. Third, medical countermeasures are limited. There is no widely available licensed vaccine and no established specific antiviral regimen. Several vaccine candidates and therapeutics are under clinical and preclinical evaluation, but they are not yet in routine use. Because of these features, high severity, animal reservoirs, and limited tools, Nipah is classified by multiple agencies as a priority pathogen with epidemic or pandemic potential. That designation justifies enhanced surveillance and research even when case numbers are low. How does Nipah spread? Evidence from previous outbreaks points to 3 main transmission routes. First, bat-to-human transmission, often via contaminated food. Examples include the consumption of raw date palm sap collected in ways that allow bats to access and contaminate it, or fruit contaminated by bat saliva or urine. Second, animal-to-human transmission. In Malaysia, pigs became infected after exposure to bat secretions in orchards and farms, and then transmitted the virus to farmers and workers through close contact. Third, human-to-human transmission. This has been documented primarily in households and healthcare facilities, where close contact with respiratory secretions or other body fluids of an infected person occurs in the absence of adequate infection prevention measures. Available data indicate that Nipah does not spread as efficiently as highly contagious respiratory viruses such as measles. However, in settings with poor infection control, it can still cause clusters and limited chains of transmission. What next? Actions for systems and individuals. At the system level, outbreaks like this test the core functions of health systems and public health agencies. Key requirements include event-based and indicator-based surveillance that can detect unusual severe illness quickly, laboratory capacity to confirm Nipah and other high-risk pathogens reliably, infection prevention and control in healthcare settings, including personal protective equipment, isolation capacity, and training. Rapid response mechanisms for field investigation, contact tracing, and risk communication. Countries in the region are also adjusting border health measures, screening travelers from affected areas, assessing symptoms and exposure histories, and isolating suspected cases pending further evaluation. At the global level, priorities include sustained financing for research and development of vaccines, diagnostics and therapeutics for Nipah and other high-consequence zoonoses. A One Health approach, integrating human health, animal health, and environmental surveillance, remains central to reducing spillover risk. For individuals, relevant actions depend on location and exposure. In areas where Nipah has occurred, public health guidance often focuses on avoiding raw date palm sap and other foods that may be exposed to bats, practicing safe animal handling, and following infection control advice when caring for sick people. In non-affected regions, the focus is on informed awareness and support for preparedness and health system strengthening rather than behavioral change for this specific virus. The 2026 Nipah event in India currently consists of a very small number of confirmed cases with intensive follow-up and no evidence of international spread. The broader significance lies in what it illustrates about emerging infections, spillover risk, and the importance of robust health systems and One Health surveillance. That's the latest from